Hello, I am Dr. Mansoor Ahmed from Cleveland Sleep Research Center in Ohio, and I am presenting this poster at the 28th annual meeting of the Associated Professional Sleep Societies. The poster presents a pooled analysis from 3 double-blind, randomized, placebo-controlled trials XP052, XP053, and XP081 involving 671 adult patients who had moderate to severe primary restless leg syndrome or RLS treated with gabapentin and carbil or placebo. Gabapentin and carbil is an actively transported prodrug of gabapentin. It is approved by the United States Food and Drug Administration at a dosage of 600 mg once daily for the treatment of moderate to severe primary RLS in adults. In all 3 studies, adult patients were diagnosed with RLS using the International Restless Legs Syndrome or IRLS study group criteria if they had experienced RLS symptoms with a duration of greater than or equal to 15 days during the month before screening, or if on treatment similar symptoms frequency before the start of treatment had IRLS rating scale total score greater than or equal to 15, as well as documented RLS symptoms for more than 4 of the 7 consecutive evenings and or days during the baseline period. Enrolled patients had also discontinued any other RLS treatment greater than or equal to 2 weeks prior to baseline. In these trials, patients with RLS were given gabapentin and carbil 1200 mg or placebo once daily for 12 weeks. Additionally, in trial XP053, patients were also given 600 mg of gabapentin and carbil. RLS symptoms were assessed by IRLS total score, while sleep disturbances were evaluated using the post-sleep questionnaire or PSQ. As previously reported, at 12 weeks, patients given gabapentin at either dosage showed significant improvement in IRLS total score and investigator-rated clinical global impression improvement scale compared with patients who received placebo. PSQ, a secondary endpoint in these studies, also showed significant improvement with gabapentin and carbil. The present analysis examines the effects of treatment with gabapentin and carbil on individuals' item of the IRLS and PSQ in a pooled, modified, intent to treat safety population that includes patients who received at least 1 dose of gabapentin and carbil and who completed the IRLS at baseline and at least once during treatment. Least square or LS, mean treatment difference for individual question of the IRLS rating scale items, and PSQ responses were calculated as the difference between the treatment groups in LS mean change from baseline to week 12 for each outcome measures. Treatment effects were also analyzed using mixed model of repeated measures or MMRM for the 10 IRLS rating scale items and Cochrane Mental Hensel-Rao mean scores testing for the 5 PSQ items at all time points. In addition, correlation between each IRLS items and 2 relevant PSQ items, sleep quality and ability to function, were assessed by Spearman's rank order test. Safety and tolerability, including evaluations of all treatment emergent adverse events, were analyzed according to the multiple laboratory and clinical measurements. The baseline characteristic of the pooled modified intent to treat safety population for this analysis are described in Table 1. As shown in Table 2, 12 weeks patient receiving once daily gabapentin and carbil at either dosage had statistically significant improvement in all 10 items of the IRLS compared with patients receiving placebo. Figure 1 shows that significant improvement from baseline in IRLS items, severity of sleep disturbances and daytime tiredness was seen as early as the first week of treatment and was maintained throughout 12 weeks. Severity of mood disturbances was not significant at 10 weeks for the 600 milligram dose. Similarly, figure 2 shows all 5 items of the PSQ were significantly improved at 12 weeks for both 600 milligram and 1200 milligram doses compared to placebo. Spearman correlation coefficients assessing PSQ items of sleep quality and ability to function in each IRLS items were positive and significant as shown in table 3. Strong positive correlation of sleep quality with coefficients greater than 0.4 was seen for 6 IRLS items, while 2 items had moderate and 2 had weak positive correlation. As previously reported, the most common adverse events with gabapentin and carbil were dizziness and somnolence. Other treatment emergent adverse events that occurred in 5% or more patients across all treatment groups in this modified intent to treat population were headache, nasopharyngitis, nausea and fatigue. This is consistent with the known safety profile of gabapentin and carbil. In summary, this pooled analysis shows that either dosage of gabapentin and carbil significantly improved each individual's IRLS and PSQ items. Correlative findings suggest a possible relationship between RLS symptom severity and sleep quality. Correlations between IRLS and PSQ items support the emerging concepts that sleep quality plays an important role in RLS symptoms and treatment.